In this video, I am going to cover your cadaver veins. Remember, this is an APR, and you can find the link to this Connect APR assignment, the ID list, in your Brightspace lab folder. Before we get started, I wanted to encourage you to look at the flowcharts and the illustrations in the text for Chapter 20. This here is This is an example of a flow chart looking at the veins in the this is an example of a flow chart for the veins in the neck and also in the thorax. And this will help you understand how the blood is flowing. Remember, in veins, the blood is flowing back toward the heart. So it's flowing in an opposite direction from the arteries. Now let's go to APR. We're going to begin with your sinuses. These are dural venous sinuses. They are going to be located in the dura mater between the two layers of the dura mater. Remember, you have a periosteal and a meningeal layer. They're going to drain the brain and then eventually go into the internal jugular back to the heart. So we're going to start with the transverse sinus. The superior petrosal sinus, remember the petrous portion of the temporal bone? So this is going to run along that. Sigmoid. So you can see the sigmoid and the transverse are there in the same general area. Occipital, remember your occipital bone. A superior sagittal, that's going to run right deep to the sagittal suture between the two parietal bones, and the confluence. The confluence is where all of these sinuses drain into on the way to the internal jugular. Let's move on to the second activity. Now we have a lateral view of the cadaver. So what we're going to begin with are, let's say, the superior thyroid vein. This is going to be adjacent to the superior thyroid artery. Remember, they're just carrying blood in the opposite direction. So for many of the veins, you're going to discover that they're going to run parallel to the arteries, just carrying blood back to the heart. So we have that. We have a maxillary, the facial, and the superficial temporal. So all of these are going to drain into the external jugular. And then the sinuses that I just talked about are going to drain into the internal jugular. Now notice, this is deeper. You have removed some muscles here. So look for that. The internal jugular is deeper than the external jugular. Here we are in the shoulder. So we're going to start with the subclavian. Now here is that anterior scalenes, and this deep to that right in here, that is a subclavian artery. So here's the subclavian vein on the left side. There is the internal jugular. You're going to have a vertebral, which we'll look at later, and then an external jugular. So the internal jugular, the subclavian. Now we're going to move into the armpit and the axillary. So keep in mind the blood is flowing in this direction back toward the heart. So it's actually going to go from the axillary. And we'll have this subscapular vein that's going to drain into the axillary. So from the axillary, you're also going to have another vein called the cephalic that's going to drain there. And they are going to go into the brachiocephalic vein. So this would be the external jugular. This here is going to be the subclavian. This would be the axillary and the subscapular. And they're all returning blood back to the superior vena cava. Let's see, I must have forgotten one. Here we go. External jugular. So continuing with the shoulder, you're going to have two veins here, one the basilic and the other was the cephalic. Remember, we are in anatomical position, so the palm is anterior. What you're going to notice here is the basilic is going to be closer to the body. The cephalic is going to be more lateral. So keep in mind, in the alphabet, B comes before C. So B is going to be closer to the body, to the midline of the body, and C will be further away. So we're going to have a cephalic there. You can see how it's going lateral. A basilic, you see how that's running medial. Connecting those two, you will have what's called the median cubital. And the median cubital is where they typically draw blood. The brachial is going to be a deeper vessel. So we can see it here. Here is a view of the brachial. So remember the radial and the ulnar veins are going to drain into the brachial. Here is your median cubital. So remember the median cubital is going to be between the cephalic and the basilic veins. This is looking at the dorsum of your hand. So remember that in anatomical position, which would be pinky is medial, you're going to have the basilic. So here's my pinky. And the cephalic, which would be on the radial side. Again, looking at, this is from an anterior view. So this is your palm. So remember, from an anterior view, cephalic is going to be thumb side. Basilic will be pinky side. Now we're looking at the thorax. So we're going to begin with, let's start with the subclavian. There's the subclavian. We could actually start with the axillary. So we're bringing blood back to the heart. It's traveling in this direction. So there's the axillary to the subclavian. And right there is this anterior scalens. And then from there into your brachiocephalics. So you're going to have a left one and a right one into the superior vena cava, which will then drain into the right atrium. The inferior vena cava is going to be down here. So we're going to have to remove the heart so that we can see it right there. Remember, these are your lungs, and this is your diaphragm. So again, this is looking at those brachiocephalic veins. Recall that you have the subclavian veins that are going to empty into the brachiocephalics. And these here are going to be your internal jugulars. Here we go. Draining into the brachiocephalics. Now let's turn our attention to the lungs. Here are your lungs. Remember, the pulmonary veins are going to be red because they are returning blood back from the lungs to the left atrium, and that blood has been oxygenated at the lungs. So we're going to have pulmonary veins here that are going to be red. They are emptying into the left atrium. And one last one is the azygos. The azygos is returning blood back from the thoracic and abdominal areas. And it empties into the superior vena cava. Looking here at the abdomen, we're going to begin with, let's just start with the inferior vena cava here. Let's get our orientation. Here's the liver. There's the spleen. This is your left kidney, your right kidney. So we're going to start by looking at the liver first. The hepatic veins are returning blood back from the liver. The hepatic portal vein is going to send blood from your GI tract, from the abdominal organs, as well as other organs in the abdominal cavity. I mean, the digestive organs, as well as other abdominal cavity organs, to the liver. Once at the liver, that blood, which now has nutrients that you absorbed across your GI tract, will be processed by the liver cells called hepatocytes. Anytime you see a portal vein, it is connecting a vein to a vein. So it's bypassing the heart. So that would be the hepatic portal vein. Now, associated with that, also draining into it, you'll notice the splenic vein coming from the spleen and the superior mesenteric, which you just see it there. The left gastric is draining the stomach. This is the stomach right here. Gastric refers to stomach. We're going to have a left renal for the left kidney, a right renal for the right kidney. And then remember that atop the kidneys, you have adrenal glands. There's one there, there's one there. These are suprarenal glands. So there's the left, you can see a little tiny vein there, left suprarenal vein. We're also going to have an inferior inferior phrenic vein coming from, here's your diaphragm, draining that part of the body, and an inferior mesenteric vein. So this is your mesentery here. Here is your colon. So the mesentery is that membrane between your digestive tract organs. We also have gonadal. Now notice with the gonadal veins, the right one is emptying into the inferior vena cava, whereas the left one empties into the splenic vein. So slight difference there. And then you have here the common iliac veins. This would be the common iliac artery. So in the same general area, but they're carrying blood into, the veins are carrying blood into the inferior vena cava. Now we're in the pelvic region, just so that we can see. Here's an external iliac. Remember that the external iliac and the internal iliac are going to be draining into the common iliac. Keep in mind, blood flow is going in the opposite direction. And so you can see that the internal iliac is coming from the pelvic region. The external iliac is coming from, it's going to receive blood from the femoral vein in your thigh region. Another look here at the pelvis. Here you can see there's the internal iliac from the pelvic region, external iliac receiving blood coming from the femoral, and they're going to drain into the common iliac. Now looking at the foot, we're going to start with the digits. Remember, this is the dorsum of the foot, top part of the foot. So those are your digital veins. And remember your metatarsal bones. So now we're going to go into the metatarsal veins, into a dorsal venous arch. So see how it forms an arch there? And then the dorsalis pedis here, if you remember the dorsalis pedis artery, is where you can feel the pulse. So this is running alongside that. And then into the anterior tibial. The great saphenous is going to be this long vein that runs the entire length of your leg on the medial surface or medial aspect of the leg, and it is draining the medial superficial tissue here. This is what is used when you do bypass surgery as the graft. Looking at the plantar, we're going to start with the digits. So the plantar digital, we're going to go into the metatarsals, and then we'll have a medial plantar vein and a lateral plantar vein, just like you had with the arteries. So here we have the thorax. Let's begin with so we're going to start with the subclavian vein. Do we have, no, let's begin with axillary vein. And then we'll go into the subclavian vein, into the brachiocephalic veins, the left and the right, into the superior vena cava, and then blood will go into the right atrium. If we look at the inferior vena cava, we've got to remove the heart there so we can see it. You can see it there. It's going to pierce the diaphragm coming from the abdominal cavity. So we'll have that. You're also going to have an azygos, and the azygos vein is going to empty into the superior vena cava. It is returning blood back from the thoracic and abdominal cavities. And this is just another view of the brachiocephalic. So before we looked at it as the right and the left brachiocephalic, so they've just cut it there. And then this is looking at the internal jugular. So if I increase this, you see the internal jugular there, you're going to have a vertebral vein that is draining the brain. And then this is going to be the external jugular there. Just to get your bearings. Again, we're looking at the forearm here. Remember, basilic is going to be, we're looking at the dorsum here. So if you're looking at the back side, remember in anatomical position, the pinky is going to be medial and the basilic is medial. And then the thumb is going to be lateral, and that's where the cephalic will be. Looking at the same thing here. So we're going to start with the digital vein. So remember your proper palmar digital vein. Those are in your digits, so you can see there. They're going to, then we're going to have the superficial palmar venous arch there, and then we're going to have a radial. Remember, the radial vein is going to be thumb side, and the ulnar on the other side. And those are going to drain into the brachial. These are deeper than the cephalic and the basilic. Remember that with the cephalic, there we have it. Remember the cephalic is going to be thumb side because it's lateral. And the basilic is going to be pinky side. And recall that connecting those two, you're going to have that median cubital. So many of these veins are being repeated. It's not like you're learning a bunch of different veins here. I just have different views for them. Looking at the same thing here, we're looking at the shoulder. So in this case, we want to start with the cephalic. There we have the cephalic. We have the basilic. And now we have the axillary there. Now, the brachial, remember, is a deeper vein here. So the brachiocephalic and basilic all are going to drain into the axillary. Looking at the thigh, you're going to have, remember the femoral drains into the external iliac vein. you're going to have a deep femoral, just like you had a deep femoral arteries here. And then the great saphenous, remember, is running along the entire leg on the medial side. All of these are going to go ultimately into that external iliac vein. Back of the knee, remember that's the popliteal. So what happens is the femoral is going to be anterior, and then it's going to go posterior here. And when it gets to the back of the knee, we call it the popliteal. Anterior tibial, remember here's your tibia. Here is your fibula. It's going to run between them on the anterior side. Here's another view of the popliteal. That's the back of the knee. Now we're looking at an anterior view. So here is the anterior tibial again. Here's your tibia. There's your fibula. So anterior tibial. And then remember along here, we're going to have the great saphenous. We're almost done, guys. So here's another view. We're looking at posterior view because I can see the heel here. So remember the great saphenous is going to be medial. There we go. And remember the popliteal is going to be behind the knee. So the popliteal drains into the femoral. So what you're going to have is a posterior tibial that drains into the popliteal, and you're going to have a fibular as well as an anterior tibial that is also draining into the posterior tibial and then into the popliteal. So looking at the foot, this is the dorsal view of the foot. We're going to start with the digits, the dorsal digital. We'll go to the metatarsal, dorsal metatarsal, and then we're going to go to the venous arch. And then we'll go to the dorsalis pedis. And then remember we have the great saphenous that is going to be running medial. So it's draining the medial aspect here of your foot. This is the plantar or the bottom of your foot. So we're going to start with the digitals again, plantar digital into the plantar metatarsals. And then we're going to have a medial plantar, remember medial big toe, and a lateral plantar. Okay, guys, this is it. Take care.